9 early signs of kidney failure you might ignore every day. Symptoms of kidney failure. This is today's important topic, and by the end of this video you will know the 9 subtle symptoms that may appear before kidney failure becomes dangerous, along with practical solutions and lifestyle changes to protect your kidneys. Your kidneys are silent powerhouses. They filter waste, regulate fluids, balance minerals, and produce hormones. Yet they rarely complain until significant damage has already occurred. That's why knowing the early signs is critical, and today we will explore each one backed by science. The first early sign is changes in urination patterns, and this can show up as needing to urinate more often, especially at night, or producing less urine than usual, or even urine that looks foamy, bubbly, dark, or contains blood. According to Johns Hopkins medicine, this happens because the kidney's delicate filters, called nephrons, start leaking protein or blood, or they fail to concentrate urine properly, so frequent bathroom visits or strange urine appearance can be the first red flag. The second sign is persistent fatigue and weakness, which many people wrongly dismiss as aging or stress. In reality, when kidney function declines, the body produces less of the hormone erythropoietin, which stimulates red blood cell production, leading to anemia. With fewer red blood cells, less oxygen reaches your muscles and brain, and you begin to feel tired even after rest, drained after simple tasks, and lightheaded. Hopkins researchers confirm this connection between chronic kidney disease and anemia. The third warning sign is swelling, or edema, in the feet, ankles, or sometimes around the eyes and hands. The National Kidney Foundation explains that when kidneys cannot excrete extra salt and water, the fluid builds up in tissues, causing puffiness that worsens as the day goes on. It's not just cosmetic swelling, it's your body's way of signaling fluid overload. The fourth sign is itchy, dry skin caused by mineral imbalance and toxin buildup. Healthy kidneys maintain a balance of calcium, phosphorus, sodium, and potassium, but failing kidneys allow imbalances, leading to itchy, uncomfortable skin that creams just can't fix. Hopkins reports that chronic itch is a common and overlooked CKD symptom, directly tied to phosphate retention and waste accumulation. The fifth sign is nausea, vomiting, and appetite loss, which are all linked to the buildup of uremic toxins in the bloodstream. Kidney Research UK notes that this toxic overload irritates the digestive system, creating a metallic taste in the mouth, bad breath, and sometimes weight loss from eating less. The sixth sign is shortness of breath, and this occurs for 2 reasons. Fluid can build up in the lungs due to kidney failure, or anemia caused by low red blood cells limits oxygen delivery. The Cleveland Clinic explains that patients may feel breathless when walking upstairs or even while lying down, and often this is mistaken for heart or lung problems. The 7th early sign is trouble sleeping or sleep disturbances. Kidney Care UK reports that poor kidney function leads to toxin buildup in the blood, making it harder for the body to rest deeply. Frequent night urination, discomfort from swelling, and even restless leg syndrome linked to kidney issues can keep you awake, robbing you of quality rest. The 8th sign is difficulty concentrating and brain fog. When toxins accumulate in the blood, they interfere with brain function, and combined with anemia, the result is poor memory, reduced focus, and confusion. Studies show that chronic kidney disease patients often score lower on cognitive tests due to this uremic toxin effect. The 9th and final early sign is high blood pressure that becomes difficult to control. Mayo Clinic research shows that kidneys play a key role in regulating blood pressure by controlling fluid and releasing hormones like renin. Damaged kidneys may retain fluid or mismanage blood pressure signals, leading to hypertension, which in turn causes more kidney damage, creating a vicious cycle. These signs are often ignored because they overlap with other conditions. Fatigue could be blamed on lifestyle, swelling on diet, and high blood pressure on stress. However, scientific evidence clearly shows that when 2 or more of these symptoms occur together, kidney disease should be suspected. According to StatPearls and the NIH, chronic kidney disease is defined by a reduced estimated glomerular filtration rate, or the presence of protein in the urine for 3 months or more. The tragedy is that millions worldwide have chronic kidney disease but remain undiagnosed because these early signs are brushed aside. So what can you do if you notice them? First, get regular checkups. If you are over 50 or have diabetes, high blood pressure, or a family history of kidney disease, you should get annual tests. Ask your doctor for a blood test that measures serum creatinine and estimated glomerular filtration rate, and a urine test for protein leakage. Second, manage blood pressure and blood sugar carefully. The National Institute of Diabetes and Digestive and Kidney Diseases highlights that high blood pressure and diabetes are the leading causes of kidney failure worldwide, so controlling them reduces your risk dramatically. Third, adopt a kidney-friendly diet. Limit salt and processed foods, reduce excess animal protein if your doctor advises, and stay hydrated. But remember that too much water can also strain the kidneys. Fourth, avoid substances that harm kidneys, like long-term overuse of painkillers such as NSAIDs, certain unregulated herbal supplements, heavy alcohol, and smoking. Fifth, stay active and maintain a healthy weight, as obesity increases the strain on kidneys, while exercise improves cardiovascular and kidney health. Sixth, monitor your medications and supplements, especially if you're taking drugs for blood pressure, diabetes, or chronic pain. Always check with your doctor if these affect kidney function. Seventh, prioritize sleep and stress management because rest and mental well-being help regulate blood pressure, immunity, and overall health, all of which support kidney function. Importantly, remember that kidneys rarely shout until it's too late. They whisper through these 9 signs. If you notice persistent changes in urination, fatigue, swelling, itchy skin, nausea, shortness of breath, poor sleep, confusion, or uncontrolled blood pressure, don't dismiss them. Get tested. Research from Mayo Clinic, Cleveland Clinic, and Johns Hopkins all confirm that early detection improves outcomes and can slow or even prevent progression to kidney failure. A 2024 AI-based study published on ArXiv even shows that algorithms can now predict chronic kidney disease risk early using simple blood and urine test data, reinforcing the importance of monitoring. Early action truly saves lives. By staying aware, getting tested, and adopting kidney-healthy habits, you can protect yourself or your loved ones from silent kidney decline. If this video has opened your eyes to something new about kidney health, please give it a like so more people can see this life-saving information. Subscribe to the channel for more health insights, and don't forget to share it with someone you care about, because awareness today can prevent tragedy tomorrow. Take care of your kidneys, and they will take care of you.